Hello everyone, my name is Arnella and my presentation will be on Alzheimer's disease. When it comes to Alzheimer's, I know firsthand how it can affect an individual. My 88-year-old grandmother was diagnosed with Alzheimer's at the age of 77. Her diagnosis had a very devastating impact on my family. Today I will be presenting my research on what Alzheimer's is, the causes, and how it's treated. What is Alzheimer's? Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. According to the National Institute of Aging, Alzheimer's usually occurs in ages 65 and up. Alzheimer's deteriorates the brain by causing abnormal buildups of protein that transform into plaques, damaging the brain's critical parts, such as the hippocampus and entorhinal cortex, necessary for forming memories. The main symptoms of the disease include cognitive impairment and memory loss. This means that the patient diagnosed with Alzheimer's will lose their ability to reason, make conscious decisions, and sensory processes. Alzheimer's poses a significant health challenge to the public because it's currently the 5th leading cause of death in the United States. Experts from the National Institute of Aging suggest that soon it will be ranked as the 3rd. Approximately 6.5 million people in the U.S. have Alzheimer's disease. At this rate, it's estimated that in a 35-year period, the number of people diagnosed with Alzheimer's will rise to 13.8 million by 2050. What causes Alzheimer's? Factors such as age, genetics, head trauma, and lifestyle can contribute to the onset of Alzheimer's. Unfortunately, in over 100 years of research and experimentation, the cause of disease is not fully understood yet. The incurability of Alzheimer's makes it one of the leading causes of death among the population. A healthy adult brain contains 100 billion neurons. In an Alzheimer's brain, the neurons are clustered and tangled. This blocks them from receiving signals and in turn causes the irreversible death of neurons, which shrink the brain. In the image to the right, you can see how the neurons are clustered and not forming connections as they are in a normal brain. The neurological networks that control cognitive intelligence are impossible to replace once they are dead or damaged. In this slide, you can see on the bottom left an image that portrays significant brain atrophy in an Alzheimer's brain. The image on the top right demonstrates the degeneration of the structure hippocampus, which, as I said previously, is responsible for memory. Top left is an actual image of a dissected brain, which you could see the hippocampus structure in there as well. How is Alzheimer's treated? Medications only help reduce symptoms and slow the progression of the disease. Cholinesterase inhibitor medications prevent the breakdown of acetylcholine. The neurotransmitter ACH works to stimulate muscle contraction, help with memory and cognition. Some examples of FDA-approved medications are rivastigmine, galantamine, and donepezil. However, medications aren't effective for everyone. They can cause reverse side effects such as mood swings, dizziness, or stroke. There are also non-drug treatments that include mental skill activities, maintaining physical activity, and stimulation of the brain. Communicating with a person with memory loss can be difficult. Engaging them in an encouraging, patient manner will help minimize their feelings of frustration. They can't remember the minute before and don't know what's going to happen in the next minute. They tend to repeat words and phrases, have difficulty organizing words into logical sentences. This makes them scared and anxious. Here is a representation of a sympathetic or parasympathetic neuron communicating with another neuron using acetylcholine molecules to send its chemical message. This communication is essential because it affects the nervous system of our brain and controls our muscular contraction necessary for voluntary movement. So the behaviors of Alzheimer's patients. In the later stages, memory loss becomes far more severe. The individual may not recognize family members, may forget relationships and the names of family members, which can be very devastating to a lot of families. They also don't know where they are or the passage of time. They can forget the purpose of utensils or how to concentrate on things such as watching TV or looking at something. Aggressive behaviors include verbal or physical, and they can occur suddenly with no reason. With the cognitive impairment and troubles with communication, they can't articulate their feelings or express their sadness, hopelessness, guilt, or depression. Here are my works cited pages. And this sums up my presentation on the causes, effects, and treatments of Alzheimer's disease. Thank you for listening.